had a metastatic colorectal cancer patient who, after completing genetic tests for RAS and BRAF, received treatment in accordance with the treatment guidelines. However, the response to the first-line treatment was not good. The patient then decided to pay for next-generation sequencing, NGS testing. It was only after this that we found a rare genetic mutation. This mutation was resulting in resistance to the standard first-line treatment. In the end, based on the NGS report, I changed the medication to effectively control his disease. Therefore, I would recommend patients undergo NGS testing early on to decrease drug wastage and treatment trial and error, leading to better therapeutic outcomes. Traditional genetic testing typically analyzes one gene at a time, starting with the most common mutations. When it comes to metastatic colorectal cancer, RAS, BRAF, and MSI are usually checked first. Each round of testing takes approximately 1 to 2 weeks, and the cost is generally more affordable. In contrast, NGS allows for the simultaneous testing of dozens or even hundreds of genes in one go. It enables us to analyze all the gene mutations related to colorectal cancer in one round of testing. However, each NGS testing cycle takes approximately 2 to 3 weeks, and the cost is relatively high. In summary, the advantage of traditional genetic testing is faster and cheaper for single gene testing. However, it may require multiple tests, bringing concerns of time and insufficient samples. Additionally, traditional genetic testing usually focuses on common gene mutations, potentially missing uncommon but significant ones. NGS, despite being more time-consuming and expensive for a single test, it also offers comprehensive information in one round of testing. In addition, if multiple genes need to be tested, NGS might be a time-efficient, cost-effective, and sample-saving option for them. Moreover, aside from common gene mutations, NGS can also identify other rare mutations, which might offer some patients additional treatment options to consider. In the case of colorectal cancer, the results of traditional RAS, BRAF, and MSI testing, or merely the RAS test, covered by Taiwan's national health insurance, are frequently used to inform treatment decisions. However, these patients may also carry rare but significant mutations. For example, of 1,000 colorectal cancer patients, around 7 may have NTRK mutations, for which effective drugs are available. However, if a patient did not undergo a comprehensive genetic testing, he or she might miss out on this treatment option. In contrast, starting with NGS enables a comprehensive assessment with a single test of the genetic mutation status. Physicians can plan more precise treatments, minimizing the need for trial and error in disease management. It not only reduces drug wastage, but also helps allocate NHI funds more effectively. Additionally, NGS testing is now mandatory for many cancer clinical trials. Starting with NGS helps establish a cancer genomic database in Taiwan, increasing prospects for Taiwanese patients to participate in international clinical trials. Clinical trials have inclusion criteria, with some trials only enrolling treatment-naive patients. Performing NGS testing prior to deciding on therapeutic strategy offers greater treatment flexibility and helps avoid missing out on new medications. Absolutely. Patients are strongly advised to proactively ask their doctors about the prospect of getting NGS testing, as it may have an impact on their treatment options. It happens all the time in clinical practice that patients miss out on possible treatments because they cannot afford the costs associated with NGS testing. As a physician, I strongly hope that NGS testing will soon be covered by Taiwan's NHI. People interested in sharing their thoughts on NHI coverage for new medical items, including patients, caregivers, and the general public, can also express their opinions through the NHI administration's patient opinion sharing platform for new drugs and new medical materials. This provides valuable input for the NHI administration's consideration of whether to include these new medical items in NHI coverage. We hope that in the future, more cancer patients will have access to NGS testing, enabling them to find more tailored treatment options.